Hello and welcome. And today I'm very pleased to introduce Paul Howard. Paul is the CEO of Lupus UK, which is obviously a charity supporting those with lupus. And we've done this very much in connection with our chat with Dr. Don Thomas, forgot his name then, sorry Don, around lupus, which was absolutely fascinating. So welcome, Paul. Really nice to meet you.
Thanks so much for having me.
So with Luke, what I'm really keen to understand is a bit about the charity. So perhaps we can start with some background and then kind of move into how do people use your charity? Because I think that's really important, because charities quite often have so much available on their website that you kind of think, actually, how do I use this charity? So first of all, please give us a little bit of background to the charity.
Yeah, no problem. So Lupus UK was actually started around the late 70s by a lady called Cheryl Marcus, who's still involved with the charity today. Cheryl was very unwell with lupus in hospital and didn't know anybody else affected by lupus. And so she did a radio broadcast to try to connect with other people affected by the disease. So she did this radio broadcast and got reams and reams of letters from people all around the country who were also living with lupus and wanting to connect. And really, that's still what the charity is about today. It's providing opportunities for people affected by lupus to meet others, because it is an uncommon disease. Many people, when they're diagnosed, don't know anybody else living with lupus, so it can be really reassuring to connect with other people. But also we are here to provide information about the disease, how to live well with lupus, and we as an organization fund research into the diagnosis, treatments, and living with the disease, and we fund specialist lupus nurses in NHS hospitals around the UK.
Oh wow, so you're a bit of everything really then.
We try to. We're the only national charity for people with lupus. So we try to do whatever we can across different objectives to support people in as many ways as we can.
Excellent. And how did you start becoming involved with lupus?
So I was friends with someone with lupus at university, and I was really inspired through that relationship to start fundraising for Lupus UK, which got me into running. I did my first half marathon. And when I graduated from university, I wanted to work within the charity sector, and particularly for a cause that I was passionate about. So I started volunteering on a part-time basis for Lupus UK, helping to set the charity up on social media, which it had no presence on at the time. This was in spring 2011. And after about 6 months, I was offered a full-time position at the organisation, relocated to nearby to the office, and I've worked with the charity ever since. I've held a few different roles during that time, and I became chief executive in March 2020.
Wow, well done. So you've climbed up the ladder, so to speak.
Yeah, it's been fantastic. We're a relatively small organisation. We've got about 9 staff, and most of those are part-time. And it means that we get a lot of experience in different aspects of the work that the charity does. So I've been able to learn a lot during my time here.
And I think lupus is one of those things that encompass so many different, I was going to say chronic health conditions, but covers so many different things, and everybody's journey is quite different, isn't it?
Absolutely. I think lupus is one of those diseases where it can cause pretty much any symptom. So we often get inquiries from people asking whether their combination of symptoms could be caused by lupus or caused by something else. And we always have to be honest and say, well, it might not be typical presentation of lupus, but it's very hard to say what a typical presentation is, and pretty much anything could be caused by lupus. So it's important to get it investigated by a healthcare professional. But I think it is fascinating, the diversity of experiences that we have within the lupus patient community.
But I think, if I remember correctly, I think Don said it takes between 4 to 7 years to sort of confirm whether you do have lupus. It's not as if one could take a blood test and say, right, you've now got it, unfortunately.
That's right. So Lupus UK did a survey which was published in 2018, and we found from about 3,500 respondents that the average time from the onset of first symptoms to diagnosis was 6.4 years in the UK. So that's a really long time to be living with, these symptoms that have such a significant impact. And I think part of it can also be a lack of understanding or awareness of the disease. So I think that same survey found that 48% of people with lupus were initially misdiagnosed with another disease first, suggesting that more common causes for the symptoms that they were presenting with were initially thought, but then their diagnosis was changed because it didn't quite fit the box that they were put into.
And would you say that is one of the biggest issues, is actually the initial diagnosis to lupus?
I definitely think that the diagnosis of lupus is one of the most significant issues. We know that lupus is a serious disease that can have long-lasting implications. It can cause a lot of damage accumulation in the body, and people can live with the symptoms and struggle with them for a long time. So the earlier diagnosis can happen, the sooner it's possible to intervene with some treatments to help alleviate those symptoms, to reduce the amount of damage accumulation, and allow people to live more of a full and active life.
So when people come to your charity, and presumably most of your work, I mean, I know you have regional offices, so is most of it interaction online, or how does it work?
It varies a lot. We try to be available through whichever method of communication is preferable to the person wanting to reach us, because it can take a lot of bravery to reach out to an organization when you're experiencing difficulty. So if we can do anything to reduce the barriers to that, then we will. So historically, we've always had a helpline, and people will still call that. It may even ring while we're chatting today. Nowadays, we do get more email inquiries and people getting in touch by social media, but also our network of volunteer-led regional groups is really important, so that people who like to meet with someone face-to-face and have sort of a friendly chat over a coffee are able to do that. But I think you're right that the majority of the inquiries we receive at Lupus UK are related to getting a diagnosis. A lot of people who perhaps are being investigated for lupus or are presenting with a lot of symptoms that are linked with the disease, and they're not making much progress. They haven't got a confirmed diagnosis, they don't have a suitable treatment plan, and they don't know where else to turn.
And it must be ever so frustrating, wasn't it? Because you go down one pathway thinking this is now what you've got, you become almost, we spoke earlier about people that when they come to you, quite often they are professional, what we would call professional patients. They do know a lot about what is going on.
That's right. I mean, especially if you've been going through that process for months or even years, it's natural to do a bit of research to learn about the blood tests that you're having done and what any unusual blood test results might mean for you, and the types of specialists that you need to see. So with lupus, because it's such a multi-system disease, a lot of people will need a referral from their GP to see a rheumatologist, and rheumatologists will frequently sort of diagnose and monitor someone with lupus, but that might not always be the pathway that someone takes. So if they have predominantly skin involvement as their symptoms with a lot of severe rashes, then they might be referred to a dermatologist and diagnosed via them. Or if their main presenting symptom is kidney involvement, then it might be a renal specialist that they see. So it can be even more complicated to understand the pathways to getting a diagnosis for lupus, because it does depend on the symptoms that someone presents with. So some people need sort of individualized and personalized guidance.
So if, for example, who would be your main person to look after you? So if you're presenting with a skin condition, obviously you're speaking to a dermatologist. Would you stay with that dermatologist, or would you then move across to a lupus expert?
as with all things with lupus, it depends.
Oh,
I think in most cases, if you've got a diagnosis of systemic lupus, it would usually be managed by a rheumatologist as your sort of primary consultant. But if some of your symptoms are most prevalent, so if you do have mostly skin involvement or mostly have blood issues like low platelets, or if you've got a lot of kidney involvement and that's your main issue, then you may see a different specialist more frequently than your rheumatologist.
right. And I suppose that's because you are coping with the symptoms of that actual specific symptom. Yes, specific symptom. That sounds a load of rubbish, but I think hopefully you know what I mean.
Yeah.
So apart from people coming to work out the diagnosis, and I think that you said that you help people how to navigate through the NHS, which is obviously a minefield in itself. What other things do people come to you for?
So we do get a lot of requests for information related to lupus. So some of these are bits of information that you won't necessarily have time to discuss with your healthcare professionals in your appointments. So things like diet and nutrition are an area which is of real importance and interest to many people with lupus. It's something that you can have more control over than things like your medication. So if you want to feel like you're having more of an influence on your health, then taking good control and having a healthy and nutritious diet can be one way of doing that. Guidance around disability benefits and entitlement to those and how to get assistance with claiming them. And issues related to employment. So getting workplace adjustments and explaining lupus to your employer. These are all issues that healthcare providers don't have an awful lot of time to help with, but are really important day-to-day issues that people with lupus come across. So we do our best to provide high quality information resources, to give people some guidance if they've got a very sort of personal or individual circumstance that they want to talk through, but also to provide people an opportunity for peer support so that they can discuss the situation with others who have got experience of it, which is more valuable than anything else, probably.
Yeah, absolutely. And it sounds like you give the practical advice. So it's great going to a consultant, but it is very much boom, 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 boom. But okay, you then say, well, how do I live my general day-to-day life? And then, as you said, the next bit is, well, and be really nice to meet someone who understands. They may not have exactly the same issues, but they've gone through the journey. Clearly, it is a journey that people go through to get diagnosis. And there's an emotional background to all of that, isn't there? That will stay with you.
Definitely. And I think for lupus as well, for many people, it's an invisible illness where you have very few visible symptoms. Some of the symptoms can be very hard for other people to understand, things like fatigue and chronic pain. You can't see them. They can be fluctuating. So one day you can be fine, and then the next day you're completely flat out and can't do anything. And so understanding those experiences and the journey that you've had to go through to get a diagnosis and the different treatments you have, it's sometimes a lot easier and more helpful to talk to someone who does have that same background, because you don't have to explain everything. And you can feel some validation and reassurance that you're not going through that alone.
Absolutely. So if people come to your website and they say, actually, yes, this is absolutely for me, what is it? Is it a membership, or how does it work?
So we do have membership available for anyone who wants to take it, and it means that you can receive our magazine 3 times a year, which has a lot of articles about the latest research and updates from the charity and our regional groups. But by no means is it a requirement to become a member of the charity. All of our information resources are otherwise available free of charge for people. So you can make use of any of the information on our website. You can get in touch with us on social media and follow our different accounts, get all of the information that way. And you're welcome to come along to any of our events or meetings. So in addition to the peer support meetings that we have, we also run education events where we'll get guest speakers coming along to talk about different aspects of lupus or living with lupus, and run question and answer sessions. So if you don't have as much time in consultations as you'd like, and you've got some questions you want to go over, you can come to one of our events and speak to the experts there.
Gosh, no, that sounds excellent. It sounds, I like those charities where you feel that you can dip in and you can dip out and take, you may be going through, a harder time than you were, and it sounds like you offer the support when it's really needed, and having a helpline, I think, is excellent.
Yeah, it's very important that Lupus UK is there for anyone who needs it when they need it.
Yeah, absolutely. Paul, thank you so much for your time. It's been a real pleasure to talk to you, and hopefully if people haven't discovered you, we might hopefully introduce people to you. So thank you very much, Paul.
That's very kind. Thank you so much.
Thank you.